So today we are discussing about bone. So bone, general anatomy of bone. So a few points regarding general anatomy of bone is a connective tissue made up of calcium salts. The inorganic calcium consists of mainly calcium carbonate and calcium phosphate. So bone is a connective tissue made up of calcium salts. Okay, bone is a connective tissue made up of calcium salt. The inorganic calcium consists of mainly calcium carbonate and calcium phosphate. Calcium carbonate and calcium phosphate, and makes these calcium salts, they make the bone rigid, tough and rigid. Okay, calcium phosphate. And the organic constituent of the bone is made up of collagen fibers. It makes the bone resilient and flexible. It makes the bone organic is made by the collagen fibers. Organic part of the bone is formed by the collagen fibers. It is made up of by the collagen fibers, which makes the bone flexible and resilient. Okay, so coming to the types of bones, we have long bones are present. Long bones are present. So long bones consist of a shaft and two ends. Long bones consist of a shaft and two ends. Okay, and example is the femur. Femur is the thigh bone, which is the longest bone of the body. Femur. And also we have tibia, which is the bone here in the leg region. Tibia, and also ulna and also radius. Ulna and radius are the bones of the forearm. Ulna and radius are the bones of the forearm, and medially we have ulna is present and laterally we have radius is present. Ulna, radius, these are the examples of the long bone, consists of a shaft and two ends. And coming to the short bones. Short bones consist of only one expanded end. Short bones consist of only one expanded end. Examples are the metatarsals. Examples are the metatarsals. Head. Metatarsals means they are the bones of the foot. Okay, metatarsals and as well as the metacarpals. Here in the palm we have metacarpals are present here. So metatarsals and metacarpals. Metatarsals and metacarpals. Okay, and coming to the, so long bones and not long bones, not short bones. In the long bones we have modified long bones. Long bones, and these are the modified long bones is the metatarsals and metacarpals, and also clavicle is also a modified long bones. Here we have, these are not modified long bones, sorry, these are the miniature long bones. Miniature long bones, example is the metatarsals and metacarpals, and clavicle is the modified long bone. Clavicle is the modified long bone. Okay, so long bones had, one is having a shaft and two ends, and miniature long bones having only one end, expanded end, and modified long bones example is the clavicle, which is the collarbone. Clavicle is present here. Okay, which is nothing but the collarbone. It is a modified long bone. And coming to the short bones. Short bones are of many shapes. They are cuneiform, cuboidal in shape. So short bones are, examples are short bones. Long bones, first one is, and according to the shape, next one is short bones. These short bones are of different shapes. They are trapezoid in shape, they are cuneiform in shapes, they are cuboidal in shape. Examples are carpals and tarsals. They are muscles of the they are the bones here situated here. The carpal bones are situated here, and the tarsal bones, they are situated here in the foot region. The tarsal bones, they are situated in the foot region, and carpal bones are situated here. Okay, carpal bones, carpals and tarsals. They are the examples of the short bones. They are the examples of the short bones. Okay, and coming to the flat bones. They are the thin plate-like structures. Flat bones, they are the thin plate-like structures. Flat bones. Examples are the ribs. Examples are the ribs. Okay, ribs are the examples of the flat bones. Okay, and coming to the irregular bones. Irregular bones examples is the vertebra. Irregular bones. Examples are the vertebra hip bone, scapula. These are the examples of the irregular bones. Okay, and coming to the pneumatic bones. Pneumatic bones means they contain air filler spaces in them. Pneumatic bones, they consist of air filler spaces in between them. We know we have discussed about paranasal air sinuses, right? So this is the maxilla bone. In the maxilla bone we have maxillary air sinuses present. So maxilla, examples of the pneumatic bones are maxilla, ethmoid, sphenoid, etc. Sphenoid and also frontal. Okay, they contain air filler spaces in between them. They add resonance to the voice and they condition the inspired air. They are nothing but the pneumatic bones. Okay. And also some bones they develop within the tendons. They develop from the, they do not present at birth and they develop lateral. They are nothing but the and some bones they do not develop, they do not present at birth and they develop after birth and they develop within the tendons of some muscles. They are nothing but the sesamoid bones. Sesamoid bones examples are the patella at the knee and the pisiform bone here. You can palpate the pisiform bone here and the patella at the knee. Okay, so these are the sesamoid bones. Okay, and coming to the developmental classification, the bones are divided into two. Okay, membranous bones and cartilaginous bones. Okay, membranous bones is the bones ossify in membranes. Membranous bones mean the bones ossify in membranes. Membranous bones. So example is the bones of the skull and also facial bones. Bones of skull and also facial bones. Okay, they are the membranous bones. They develop in membranes. Okay, and coming to the cartilaginous bones, they develop in cartilage. That means in the membranous bones, over the membranes, the osteoblasts cells they start forming the bone. And in the cartilaginous bone, what happens here is the bone cells they get deposited on the cartilaginous model. Okay, so cartilaginous bones examples are the bones of limb. Okay, according to the attachment to the skeleton, axial skeleton and appendicular skeleton is there. In the axial skeleton, the examples of the bones which are in the axial skeleton are the skull, thoracic cage and vertebral column. They form the axial skeleton, and appendicular skeleton is formed by the bones of the limbs. Okay, and so these bones they help in the transmission of the weight. They consist of 90%. These bones have high regenerative capacity. So after fractures also they can heal very fastly. Other than blood, blood has most high regenerative capacity. And the next is the bones. And here the bones provide attachment to muscles, ligaments, and also the muscles, ligaments. So they helps in the movements of the body, and these bones are responsible for the growth of the body. And in some situations, the growth of the body decreases, and this is called dwarfism, because when there is a defect in the when there is a defect in the cartilaginous bone and the defect in the developmental classification and the defect in the cartilaginous bone, here what happens here is the growth of the bones gets stopped. Here what happens here is the trunk is normal size, and here what I have said, the muscles, the bones of the limbs, they are short in stage, which results in dwarfism. Okay, and coming to the macroscopically, the bones are of two types: compact bone and cancellous bone. Compact bone, its texture is very hard. It is ivory in texture. Okay, compact bone is ivory in texture, and here the compact bone, it is present in the cortex of the long bone. And here The compact bone here, it is extremely porous. It is extremely porous, and cancellous bone here, it is open in texture, and it is made up of meshwork of trabeculae. It is made up of meshwork of trabeculae, and the cancellous bone can be seen on the ends of the, on two ends of the bone. We know that the bone has two ends, upper end and lower end, though the cancellous bone can be seen here and the compact bone can be seen here. Okay. Microscopically also, the bone can divide into lamellar bone, whether it is compact or cancellous. Here what happens here is piles of lamellae, they get formed over the bone. Okay, thin plates of lamellae, they are formed over the bone. That's why it called lamellar bone. And fibrous bone, they are seen mainly in children. And dentine bone, we can see they are present in teeth. Dentine bone, they are present in teeth. Okay, and coming to the structure of a long bone. So we know that long bone has two ends. The first, it is covered by periosteum, and inside the periosteum we have cortex is present. Cortex is made up of compact bone. This is the cortex, and on ends of the bone, it is occupied by cancellous bone. Okay, which is formed by the meshwork of trabeculae. So and here we have medullary cavity is present here. Cortex, periosteum, cortex. First is periosteum, next one is cortex, and next one is medullary cavity. Since medullary cavity, it is hemopoiesis in function. It produces the red blood cells. In fetal life, all the bone medullary cavities, they supply the red blood cells. But while we are growing up, during adult stage, what happens here is some medullary cavities, they are filled with fat and adipose tissue. We call it as yellow marrow cavity. Otherwise, in the fetal stage, all the bone marrow, they are red in color, and these red bone marrow, they supply the red blood cells. Okay, so medullary cavity is present here. This is the periosteum, and this is the cortex, and this is the medullary cavity. On either side of the long bone, we have cancellous bone is present here. Okay, so periosteum, cortex, and medullary cavity. Okay, coming to the, we know that the long bone is consists of shaft, and this shaft is developed from the primary ossification center. We call this shaft as diaphysis. And the part of the bone which is developed from the secondary ossification center, we call this part of the bone as epiphysis. Okay, this is called a epiphysis. And the epiphyseal end of the bone, the epiphyseal end of the diaphysis, we call it as metaphysis, which has a high amount of growth can be seen here in the metaphysis region. And epiphyseal plate of cartilage intervenes between the metaphysis and epiphysis. This is the epiphyseal plate of cartilage. Epiphyseal plate of cartilage is responsible for growth of length of the bone. Okay, epiphyseal plate of cartilage. So the diaphysis ossifies from the primary ossification center, and the epiphysis, they ossify from the secondary ossification center. What is meant by primary and secondary? Primary ossification center means they start ossification during the 6th week of intrauterine life, and the secondary centers means they start ossification after the birth. Okay. So the metaphysis, it shows high amount of growth here, and the epiphyseal plate of cartilage also responsible for the length of the bone. And once epiphyseal plate of cartilage fuses with the metaphysis as well as epiphysis, the length of the growth of the bone stops. This is the epiphyseal plate of cartilage. Okay, and coming to the Arterial supply of the bone. Coming to the arterial supply of the bone, the artery is the nutrient artery, and the nutrient artery, it is situated away from the growing end of the bone, and the nutrient artery, it enters here from the neurovascular hilum, and it divides into more and more number of branches, and in these arteries, this nutrient artery, it anastomoses with the epiphyseal arteries and metaphyseal arteries also. It anastomoses with the epiphyseal and metaphyseal arteries also present. That's why bone is very highly vascular in nature, because the nutrient artery anastomoses with the epiphyseal and metaphyseal arteries. Not only the nutrient artery supplies the bone, it is also supplied by the metaphyseal arteries, epiphyseal arteries, and also periosteal arteries. So the bone is highly vascular in nature. Okay, so that's about the bone.